Hello.
Hello, everyone. We are so excited to be here to play Nurse Squad again tonight.
And we are playing.
Oh, what are we playing? Yeah.
Nutrition.
Your favorite, right?
My favorite.
I actually like it.
If you're new here, I hate nutrition. This is not my favorite subject. It's like one of my least favorite, one of the ones I find least interesting, and one of the ones I'm worst at, which means I probably should brush up on it if we're being honest.
Yeah. But guys, nutrition is so important. So some of you I know, and I'm curious for people who are attending, like, did you have to take a nutrition prerequisite, or was nutrition part of your nursing program? Or like, what was your story? For me, it was part of my nursing program. We had like a class. How about you, Meris?
You guys might know, I went to nursing school twice. The first time I failed out, the second time I graduated top of my class. So if you failed before, it's okay. I promise you can be successful. The first time it was a prereq and it was a class, but it wasn't for nursing. It was just like nutrition. And I found it very confusing because it was very like all over the place, because this was for people doing all kinds of degrees. Yeah. When I went to nursing school the second time, it was a class taught in nursing school for nutrition for nursing practice, and it was much more specific, much more focused, and I really felt like it tied in with like, so this disease process, you'll see this, and it was much more like I could track, I could follow it.
Totally. Yeah, ours was just for just for nursing students, and it was like our first semester.
Oh, interesting.
And honestly, like, and it went over a lot of different things. It went over nutrition, it went over hormones, talked about exercise, and honestly, some of the best advice I got in nursing school, I got in my nutrition class. And my professor, Dr. Long, I think was his name, he basically said, like, when your cortisol levels are really high from stress or anxiety, really the only way you can bring those down is to like go out and do vigorous exercise. And that has been shown to bring down those levels. Like, it really, really helps. And so
bad news for me. Bad news for Meris.
So I remember that, because honestly, like, that is like, sometimes exercise is like the last thing I want to do. I do not want to lace up those sneakers and go do that exercise. But I'll be like, okay, look, I'll just do it for 5-10 minutes and I can turn around or not do it anymore if I don't want to do it. And inevitably I end up doing it the whole time, feels so much better. So anyway.
Honestly, such good advice. And that is the advice that I give to students a lot of the time, is like, if momentum carries momentum. So if you can just say to yourself, I'm going to sit down and study for 5 minutes, or I'm going to, I'm writing a paper, I'm just going to find one source. Before you know it, like an hour and a half has passed and you're like, oh, I might as well keep going. So honestly, just like flinging yourself into the thing, you're going to get that forward momentum and you're like, well, I might as well keep going.
Totally. So I see everybody saying hello and hi. We are so happy you are joining us tonight. We hope we're going to have lots of fun. And so nutrition, no matter if you had to take a class or it was a prerequisite or what, nutrition is so important for nursing, and you will get asked questions about nutrition in a bunch of your classes. So pharmacology, nutrition comes up. Medical surgical nursing, nutrition comes up. Maternity nursing, peds, like, the nutrition is just, you better know. Everywhere. Yeah, you better know which foods are high in potassium and vitamin K and all that stuff, right? Because you're totally gonna get asked that stuff, right?
Okay, so listen, before we even start, I need you guys to understand, I may not be able to give you many hints when it comes to answering these questions. I may need you guys to like really carry this team, because oh boy, even though I helped with the writing of these questions, it's gone. You want to know what has potassium in it? My potassium pill. Like, that's about like all I can tell you. I have no idea. So friends, I need you to really rally tonight and carry Team Meris to victory without me, because
okay, so I'm sure there's a question in this card game asking about foods rich in potassium, but Just so you all, so if you know what foods are rich in potassium, put them in the comments right now, okay? Because I'm telling you right now,
Like
you have to know that.
potatoes.
Potassium.
Is potatoes have
Yeah. Oh,
potassium?
bananas. Okay. We got
With banana?
bananas. What else we got?
Oh, I have one. I know one. Salt substitutes. I got that.
Yes. That is a great one. Yes. Salt substitutes are high in potassium. Potatoes. Yep.
Okay. All right. All right.
Raisins.
Raisin.
Yep.
Yeah.
Okay,
Man.
good. You guys know. You guys know.
You guys are
Because
too smart.
you guys know what kind of question they're going to ask that on, like, right? Like, your patient is taking a diuretic, like furosemide, and how do they need to adjust their diet, right? And that
You
requires you to
know,
know that
now that I'm
that
thinking about it, I
they
take
ask that.
spironolactone, and I probably should know what foods are high in potassium to avoid them.
Correct. Right. So we have
Whoops.
certain diuretics that cause low potassium and certain diuretics that cause high potassium. And so you got to know those potassium rich foods so you could tell your patient to increase or decrease their intake depending on like the diuretic they're taking. So
Maybe somebody needs to do some patient education with me because I don't think I'm being a very good patient.
and then and then of course you got to know vitamin K, right? With warfarin. You got to know your green leafy vegetables
It's just,
because
yeah, it's everywhere.
green leafy
Oh,
vegetables.
calcium and vitamin D for your patients, with osteoporosis, your patients with osteopenia. You got to know all of that stuff. And let me
Mm-hmm.
tell you, it never goes away. It never goes away.
So calcium is easy to me. Like everybody knows, like there's dairy
Yeah,
products, right?
but you know what? But you know what they do? They trick you. They don't give you a dairy product option. They're like, which of the following is the highest in calcium? And then it's
Oh, they
like
give you broccoli because
four
broccoli is
random
super
garbage.
high.
Yeah.
Yeah, yeah, that's true. They do. They do try to trick you like that. I know. And then
No one. So TD and MK said, who did your patient education? Let me tell you real quick. As a patient taking spironolactone for hormonal acne, not for anything related to whatever, not a single person said a single thing to me about potassium. And I was sitting there going, y'all might want to tell me to limit my intake of potassium. Nobody told me. So here's
oh,
my reminder to you, future nurses and working nurses. You got to teach your patients this stuff. You can't count on them knowing it ahead of time. Okay. So listen, Mina Mouse, you are on my team. Okay.
and
Let's cover
Mina
this.
Mouse is like, let's get down to business. Tell me what the teams are, so we don't. So I. She's like, quit the yapping and tell me what team I'm on, right? Okay. All right, Mina.
We will.
All right. All right, Mina. So, okay. But first, so yes. Okay. We're going to do the same teams. Is anybody sick of being on like the same team every time? I hope not, because it's definitely easier for us just to stick everybody like A through L is Team Cathy and M through Z is Team Meris. It just makes it easier, right? Because it's already confusing enough. People.
Yeah, I was going to say, we are senile. Like, we can't go screwing this up. We can't mess around with the order because we'll confuse everyone.
Totally. So yes, so everybody who's attending, you are on a team. If your handle, like your username is A through L, you are Team Cathy. And if you are M through Z, you are Team Meris.
So tell us in the comments.
What?
Check you all.
Yes. Yeah. So put in the comments what team you're on.
Lucy,
and that way
Cathy,
we can tell anyone who's not getting the right team there.
Yeah,
and
because every time y'all are out here giving answers to Team Cathy, I can't. Trisha, Team Meris, love it. Yes, ma'am.
yes, awesome. And what do we got here? Clarissa's
yes.
Team Cathy, Caitlin, yep, Jessica, Meris, Alexis,
let's get
Cathy.
it, Tiger Eyes.
All right, nice. Also, who was here last time when we played peds? And I have to say, we are so stupid. We got off we were so excited to give away Nurse Squad, and then we gave it away, and we're like, "Yay, we'll see you guys later!" And we never announced. Bye. We never announced who won.
Who won? And Cathy texts me, and she was like, "We didn't announce the winner." And in my brain, I was thinking like of the Nurse Squad, like the giveaway, And I was like, yeah, we did. Like, what are you talking about? It was this person. And she's like, no, we didn't tell who won the game. And I was like, oh my God. So we have to give props where props are due. Team Cathy won last time, as salty as I am about it.
So if you were here last time and you were on Team Cathy, we won. We won. I don't have a fancy trophy like Meris. I don't know where she gets these trophies from. Like, I have no trophy, but I feel like I need a trophy.
Here's one
you
for
and your
Team
trophies.
Team Cathy, super peed stars.
I'm going to put on my list right now. I'm ordering like a gargantuan trophy. Order trophy. Okay. It's going to be so much bigger than Meris's trophy.
It's real when she's writing it down. Oh, we're going for size now? All right, bet, Cathy, bet.
All right, so who is, okay, what are the teams again?
Team Cathy.
You're Team Cathy. So
A through L.
It's time to bring it.
If your username, your handle on YouTube, A through L, you're on Team Cathy. M through Z, M Meris through Z, you're on my team, baby. Let's go.
All right. So who is new here? Like, who has not played Nurse Squad? Is there anybody new here? Because I'm going to explain kind of briefly how we play, like what's in the game, because you can purchase this game. We have 8 different Nurse Squad games. We have Med Surg, Farm, Peds, Maternity, Health Assessment, Psychiatric, Mental Health Nursing.
You already know. You already know what I got to do.
All right, bring them over. Yep. Don't they look so nice all together?
So beautiful.
They are beautiful. They're beautiful. They've got an awesome little magnetic closed box, like a really high quality box. And I know they're so pretty. And
our babies.
Inside, you can there's directions on how to play. There's lots of different ways to play. Like, you don't have to play cutthroat like we play here. Like, we play hazards on each other and we snack talk and all that stuff here.
Oh, yeah. But there's alternate gameplay instructions. Yeah. And there's, so in the thing is like the little instructions. And then there's a QR code here that you can scan that shows you like a video tutorial, and then you can also find alternate gameplay instructions. So again, QR code, you can scan it, and we've got different ways to play. We've got a more, if you're like need that visual how to play, if this is a little too hectic for you, we have a very nice top-down view of how to play Nurse Squad. There's ways to play by yourself in large groups, like in your classroom setting, in study groups, people like 2 to 4 players, in groups like clinical, to play collaboratively and cooperatively, or to play cutthroat like we do.
Right. You don't have to do that. In the box too, you'll find avatars. So if you want to play as a member of our Nurse Squad, you can pick the avatar that speaks to you. So Meris, who are you playing tonight?
So, guys, typically I go with Willow the Wiz because I just very much identify with her. But because he is on the box for nutrition, I need some of that energy. So I'm going with Lamar the Leader today because I need for Lamar to bring the nutrition energy and help me not be so garbage at nutrition. So Lamar, look at his golden stethoscope. Like, he looks so cool. I know.
That's really cool. Oh, they all have like a golden. I never even noticed that little detail. There's so many cool details on these illustrations, and I never noticed the gold stethoscope before. That's super cool.
Time.
All right, I'm playing as Izzy, the improviser, because I've been working on my fitness, and I am like bringing the guns. So I've been doing, like, I worked out yesterday, and I like my upper body was like, oh baby, when I was done. So
y'all aren't ready. We're going on this cruise together, and I've got to I need to spend the next 4 weeks like doing some upper body exercises so I can hang with Cathy, because man, she is swole. She's swole, and I'm here like little limp noodle. Like, oh man. Yeah, I'm ready. Watch your social, because you know that there's going to be some Meris and Cathy shenanigans when we are together.
Totally, for sure. So I'm working on those guns because Meris keeps talking about my guns. So I'm like, oh man, I better No, I have a goal. Like it's to really get them super buffed up before our cruise in April. So, okay. So I'm playing Izzy, the improviser. And then the other thing you can find in the box. Oh, and by the way, when we're done going through this stuff, we have some special promotions and giveaway tonight that we will
Y'all
talk
know
about.
we literally cannot help ourselves, right? Like if you
Totally.
are coming to a live, there's always a promotion, there's always a giveaway, because if it were up to us, we would just give it all away. So get ready.
Totally. All right, Meet a Mouse went to HIT class 2 times this week. Yeah, I was doing the HIT this week for sure. Doing it again tomorrow. The other thing you can find in the box are the hazard cards. So these are cards that you can play against your opponent. So when it's my turn, instead of answering a question, I can play a hazard card. And Team Meris has to answer the question correctly or they lose 4 points.
So in traditionally, if it's, if we're going to answer a question and I'm asking Team Cathy, here it is. This is a nutrition question from the foundations section and it's worth 1 point. And if we did that, then Team Cathy gets 1 point. If they answer it correctly, they get 0 points if they answer it wrong, but nothing bad happens to them. With a hazard card, if they answer it correctly, nothing happens. But if they get it wrong, they lose 4 points. And that's more points than any single question is worth. So you want to pay attention when you're playing so that you can really focus on what kind of a card is coming up. Like I don't want them to, if there's a 3-point question, right? I want to use that hazard so that they don't get 3 points, even if they get it correct, but also it's harder questions. So maybe they'll get it wrong and they'll lose 4 points. So you got to be strategic with that.
Right. And you got to watch Maris too, because she's definitely strategic on this stuff. So, but you can totally play without using the hazard cards, by the way. Like you totally don't have to. Like when we were at a conference, like last fall, some students came and were playing our game and they were just trying to get through as many questions as they could. They were not playing hazards on each other. So again, you can play a lot of different ways. And then there's a nice big stack of question cards, which are either 1, 2, or 3 points. So 1 point questions are the easiest, 2 point are kind of middle, and then 3 are the harder questions.
And as you can see, there's 2 questions on every card. So there's double the number of questions as it appears. The stack is really twice as big, right? And the idea being that we would decide, are we playing the top or the bottom, so that there's completely unique questions every time. So no question is asked the same way. We might ask you about something that's really important twice, top and bottom, but in a different way.
Right.
And point being there so that you've got 2 full gameplays. Even if you went through every single card in this deck in one sitting, you could do it again with the other half of those questions and you wouldn't get a repeat.
And one thing that I really love about Nurse Squad is it makes your brain work in a different way. Like you are used to multiple choice questions, select all that apply type questions, etc. And you can kind of look at your choices and pick the best thing. With this game, you have to come up with the answer like in your brain. There's no like multiple choice in general. I think maybe there's a couple like name the thing that is very rare. Like it's
very
mostly
rare.
It's
like
fill in the blank.
Yeah, we did that on purpose because you're so used to thinking in that NCLEX style question mode that when it comes to being able to produce the answer on your own, if you can do that, if you can dig deep and pull that answer out, it's going to help you remember that better. And it proves to yourself too, I know this, like I got this.
Totally. Hey, so before we start playing though, well, a couple things. CD bought a rolling cart for their ultimate bundle, and I have all the flashcards and games and they fit perfectly in there. Okay, so we need to see this, CD. So if you want to get on camera with us, do we know how to bring them on camera?
I don't know how to do that, but you should totally send us a picture.
Yes.
Please, please, please. I have to see this. I have a rolling cart that I use for my massive pile of to be read books. It's like overflowing. I love the idea of using it for your level up stuff. I could use it for my level up stuff. That's brilliant.
Yeah, we totally need to see this. So yeah, definitely show us. Trisha wants to see it too. So
yeah, see.
All right. So before we start playing, guys, We do have a special promotion tonight, and it's a really, really good promotion. So everybody who is here tonight live can get a free month of membership on our website. So you get a free month of membership using the code free month. And if you're not familiar with our membership, we have all of our core content videos without ads. We have over 1,000 review questions. We have our cram courses, and actually our nutrition cram course was just added there. So if you need to brush up more on nutrition, you can get your free month of membership. Go on there and watch the cram course that I just finished. It's 1 hour and it gets you all the important stuff you need to know. So we have our cram courses. We have contact hours on our membership site. So if you are in a profession, like if you're an LVN or LPN and need to get your contact hours while you're going to school, you can totally get those as part of your membership. And we have our dosage calculation course as part of membership too, which is huge. And that's probably worth like what, $59. It's like a complete course with all the questions and everything, tutorials, video tutorials, like everything. So,
and we also we now have completed the NCLEX review questions. We have over 1,000 questions for you to test your knowledge of all the subjects. So if you're like, I need to brush up on nutrition, health assessment, whatever it is, we've got that stuff for you so that you can go study that. And it is awesome. So wherever you are in the program, it's going to benefit you.
Totally. And okay, the other thing I forgot is that as a member, you get special discounting on all of our products. So if you're a member, you get discounts on all of our flashcards, all of our Nurse Squad games, all of our, our planner, our dose calc book, our tip of the day, like all of our products.
You're out there to buy. All you need to do is make sure that you are logged in to the site before you add things to your cart, and that discount will automatically apply. So if you're not already a member, go sign up right now. Well, maybe wait 30 minutes, but go sign up and use the code free month, all one word, free month. That will get you a free month. We're all very surprised. That will get you a free month of membership. You can check it out, and then you can see if that's something that you want to keep ongoing. And then you can absolutely have that discount. And we're bringing new stuff like literally all the time. Like membership has evolved so much over time, and it's wonderful. So just go to our website, leveluprn.com. Add the Level Up RN membership to your cart and use the code free month to check out.
And you get free. And I think you guys will love it. It's like, it's got so much great stuff on it. So hopefully you love it. I'm working on the MedSurg cram course right now. I'm
working on peds. Yeah.
Okay. So we're having a lot of fun with this cram course to give you like the most like test worthy information so that you can do that last minute review before your exam. So the other thing we're going to do tonight later on, after we play Nurse Squad for a little bit, is we are going to give away a Nurse Squad game of your choice. If you already have all, because I know there's some people on this, I know there are people here who have all the Nurse Squads, like CD. CD's got all the Nurse Squad. Our support team will be able to help you. If you end up being the winner of the giveaway, then they'll take care of you. Okay. So we are giving away a Nurse Squad game of your choice tonight. So definitely, stay on the live with us so you can get a chance to win that.
And so that I can see what bonkers thing Cathy makes you put in the comments to win. It's my favorite part of this.
I was filming all day today and my brain was a little mushy and I'm like, I don't have anything super creative, but I need to, like when I'm not so tired, I need to come up with the good stuff.
Oh, so I love this suggestion, a critical care course in the future. Listen, your girl is obsessed with critical care, so I got you. I'm gonna figure that out. We're gonna figure it out. I love that idea.
Yeah, for sure. For sure. We are like Meris was saying, we're constantly figuring out new stuff, things to help both nursing students and practicing nurses. So
we have so much cool stuff coming that we can't even tell you yet. And I'm just like, it's going to be amazing.
Totally. Okay. So let's get ready to play. Everybody know what team they're on. So for people who have just joined, if your username is A through L, you are Team Cathy. If your username is M through Z, you are Team Meris. And I don't remember who asked who last time. Who should you know
I
me?
think I asked you first last time.
Okay. All right. So we're gonna ask Team Meris, and I have a nutrition foundations question. Okay. Yep. I've got my thing because
Okay,
that
good.
totally. Yeah. No. Thank
It
you.
matters.
Because last time I didn't have that, but you guys ended up answering everything really quick anyway, so it didn't matter. All right. You guys ready? For 1 point. This mineral is important for hemoglobin formation and oxygen transport.
Can they all be this easy?
1 point. What mineral is important for hemoglobin formation and oxygen transport? Oh, there it is.
Done.
1 point for Team
Hysterically,
Meris.
though, neither one of you is on Team Meris. So,
okay,
I mean, Team Meris got there, but man.
Hey, okay, so who am I going to call out here? Deanna, you are Team Cathy. Who else we have here messing up? Dee, you are Team Cathy. I'm not really mad, but it's okay. I'm going to pretend like I'm mad here. Jessica Wu, you are Team Cathy. All right, I don't know how to say it. Abanya Shari, you are also. Oh, yeah. What does iron require? Okay, sorry, you were asking a question. I didn't mean to yell at you. What is the iron requirement to be? Well, the iron requirement during pregnancy, isn't it 72 milligrams a day? Or do I have that backwards? Is it 27? No, I think it's 72. Come on, maternity lady. What's the iron requirement? Okay.
You know, that's a great question, Cathy. And I would really encourage our students to build their own understanding of that by looking the answer up on their own.
In our flashcard deck.
That'll really strengthen those neural networks there. And
totally. All right. Yeah. All right. So Ashley, you are Team Cathy. Who else do I need to yell at here? Okay, no, I don't think I need to yell at anyone else now. Okay.
All right.
Who's on the naughty list? Anyway, okay, we're ready for our question.
Okay. Are we doing top or bottom? I forgot to ask.
Oh, I did bottom this time.
Oh, okay. What is the expected range for a patient's albumin level?
Oh.
We were just talking about this.
Okay, so albumin. I did a skit on this. To help you remember the normal range. Yes.
Yep, you got it. Clarissa, you're the real MVP, to be honest. The iron requirement, as Clarissa has looked up, it's 8 milligrams for men, 18 milligrams for women, and 27 milligrams during pregnancy. Thank you, Clarissa.
Okay, I totally mixed my numbers up. I thought 72, 27. Right. It was close.
You got closer than I did. My answer was going to be a big, I don't know.
So, all right, yes. So have you guys seen my skit on albumin? Because like we just where Al is always bumming $3 to $5 from you. So if you can't remember the normal range,
yes. Same as potassium.
And it is the same as potassium. That's the other good way to remember.
Yep.
So
100% love it.
Okay. Awesome. All right.
Good job.
Oh, I just pulled the same card. Hang on, put that on the bottom. All right. 2 points. Nursing practice. Oh, this is an important one. You totally gonna get tested on this, guys.
I'm ready. What
types of foods decrease the absorption of iron supplements?
Oh, yes. Got to know this. Gotta know this.
What types of food decrease the absorption of iron supplements? You will 100% get tested on this at some point in your nursing exam.
Yeah. Team Meris is answering this, as Clarissa has reminded us.
Oh, there it is. Allison. Yes. Dairy products. Yep. So
Allison,
calcium-rich foods.
Team Cathy.
Dairy products. Oh, man. Do I need to yell at more people? Okay, that was a Team Meris question, y'all. So, Allison, girl, you and me need to have a talk. You are on my team. You're on my team.
Yes, dairy. So calcium decreases the absorption of iron. So for instance, if you are taking an iron supplement, you don't want to take it at the same time as you have your morning yogurt, right? Like we're not doing that. We're not taking it with our cereal in the morning and our, with the milk. We're going to take it with somebody else said it right there. Vitamin C. You want vitamin C. Vitamin C increases absorption. Calcium decreases absorption. Yeah.
I have a skit on that one too, actually. So
Does.
if you all want to look at funny ways to remember some of these rando things, then check out our skits on TikTok. Okay. Team Cathy, we are ready for our question. You guys ready?
2-point question from nursing practice. Oh, this is too easy. What is the only way that the initial placement of an NG tube can be accurately confirmed with certainty?
Okay, so how do we confirm the placement of an NG tube initially?
And this is very important.
Super important.
I do it every shift, basically.
Yep.
And this is Team Cathy is answering. Yes.
X-ray. Nice job.
Yep.
All right, Mina Mouse was asking earlier, do you take it with orange juice? Yes, orange juice would be a wonderful thing to take with your iron supplement. So good job.
So yes, you got to pay close attention to these questions because it's talking about the initial placement of the NG tube. We're going to initially confirm it with X-ray, and then we can do things like testing the pH of the aspirate and all of that. So yes, good job, guys. Also, I got these pictures of this rolling cart, and it is bonkers. I'll have to show you when we like take a little break. I got to download them, but it's like gorgeous.
All right,
so pretty.
All right, I want to see it. Do we need one? Do I need one?
Probably. You need one. I need one. Yeah. Why have I not? My stuff is like scattered all around this office. This is so smart. This is so smart.
Well, and if I put it on a cart, I could like have it here by my studio and then like bring it over there to my desk and stuff. So
yes,
yeah,
exactly.
Nice. Totally.
Oh, man.
All right, Team Meris, you ready?
Yep, we're ready.
All right, we have a 1-point nutrition foundations question. The breakdown of proteins for energy is known as what?
Oh, yes. Okay. Breakdown of protein for energy. So there's 2 words that mean the opposite of one another. One is building it up and one is breaking it down. So don't worry, guys.
We're talking about the breakdown. Oh, forgot this.
I'm going to show you the cart in a minute and we'll tell you all the things. But breaking down. So amino acids are the proteins that's what we're breaking the proteins into. Catabolism. Yes. I always remembered that catabolism was catastrophic. So if something's catastrophic, it means that if there was a big damage or, something has broken down, a building was blown apart, it was catastrophic damage. That's how I remembered it. And then anabolism, I think of A for adding
amino acids together. All that starts with A. So good job, guys. Lots of people coming in with that same answer. So good job.
All right. 2-point question from the foundation section. You guys are getting lucky because of the previous question. Caregivers should be taught to limit a toddler's intake of milk to 2 to 3 servings per day in order to reduce the risk of which condition?
Well, girl, you just gave the clue. Like you gave them the clue.
I know, it's on me.
All right. So if our toddler is filling up on milk, then they are not consuming other foods, as many foods. Yes, there it is.
Iron deficiency anemia. Yes. Yep.
They're chugging the milk, and that means and milk is low in iron. So when they're doing that, they're not getting a lot of iron, they're filling up, and they're not eating as many foods that are rich in iron. So they end up with iron deficiency anemia.
And then the calcium also chelates the iron that they do take in. And so it's going to decrease their absorption of that iron that they're managing to take in. And now they're going to have iron deficiency anemia. So yes, you guys are very smart.
All right. So anybody who's joining us, I'll do this periodically throughout. If your username is A through L, you are Team Cathy. And if it's M through Z, you are Team Meris. And so right now, Team Meris is going to answer a 2-point foundations question. All
You got
right.
it.
So this means people with usernames M through Z are going to answer this question. And Team Cathy people, A through L, are not. They're going to remain silent and wait. So, okay. Measurable excretion, such as urine or emesis, is known as what type of water loss?
So there's two types of water losses, right? This goes back to foundations, fundamentals, right? We're talking about the types of losses. There's one type that's measurable, like urine, emesis, things that we can literally measure and say 650 out of that Foley bag or whatever. And then there's the other type, which are you can't measure, like the fluid that we lose by breathing, right? Or sweating. Oh man, come on, guys. I believe in you. There's two types. So what's the type that we can measure?
Jorge's like, get the timer going, girl.
Yeah.
Sorry,
Get it
I was
together.
delayed. Oh,
sensible losses. Yes. Yes.
But you know what? You're Team Cathy. Oh my God, y'all.
It's all right.
You're
It's
Team
all right.
Angie. You're Team Cathy too. Okay,
No.
Cathy, my Cathy peeps. If your name starts with an A through an L, don't be answering Team Meris's questions, man. They were gonna lose that one too, man. I was feeling it.
Nurse Rose on the go had my back. She had me.
Oh, Whitney came through for you. Yeah, okay, fine. Y'all would have probably gotten that point anyway. But seriously, y'all, Team Cathy, we gotta keep it close to the vest. I know you're like excited. You know the answer. I get it. Like I would be excited too to like share my answer that I know. Like I get it. But you gotta just like wait. So okay.
So
It's all right. I love you all. Team Cathy, you're the best. Just don't be answering Team Meris questions.
Yes, Mandy, you're on my team. Sensible losses are losses you can measure, like emesis, urine, NG tube output, things like that, drainage, like from a wound vac or something like that. Insensible losses are those that we cannot measure, like the water we lose by breathing, sweating, things like that. All right. Oh, this is a good one. 1-point nursing practice question. Following bariatric surgery, patients are at risk for which unique complication?
Okay. Can I give some signs and symptoms of this complication?
Sure.
Or no. So like diaphoresis and like diarrhea and like palpitations. Yep, there it is. That was so fast. You guys are so fast.
Mandy, you're on my team. Don't answer for Team Cathy. Y'all. Yes, dumping syndrome is correct. And there's an intervention that you can educate your patients to do to decrease their risk for dumping syndrome.
Oh, is that another question somewhere? Do you guys know what you maybe? Well, that's all right. You guys can answer.
We'll see.
Yeah, if we want to teach our patient to avoid dumping syndrome and try to slow the movement of gastric contents, what could they do after a meal?
And this is something that we would not tell anybody else to do. Yes. We never tell a patient to lay down after meals, right? That's one of those things that we would just never do. But that's why we avoid words like never and always on NCLEX questions, because sometimes we do. These patients who have dumping syndrome lay down because it slows down the movement of food through the GI tract.
Yep. All right, Mandy, we'll try to make it more clear, like whose turn it is to answer the question. I'm sorry, it's confusing.
I know. There's a lot going on.
Yeah, and other things. Yeah, you want to limit liquids during meals for sure. Yep. You want to lay down after meals, drink water between meals. Yeah, so you're going to limit fluid intake during meals, and you're going to drink your fluids in between meals. Yeah, and 100%. You're gonna have little small meals many times a day versus
those guys are so like smart.
I know they're super smart. Probably because they study with our cards and videos and stuff. So okay, nice job. Okay, this is
Team Meris. If your username starts with M through Z, it is your time to shine. Everybody else.
Okay, so this is a 2-point nutrition foundations question.
Okay.
The nurse educates a patient of average weight that they should gain how much total weight during pregnancy?
Ooh, okay. So we're talking about a patient who is of average weight. So they're not underweight, they're not overweight, they're the average weight. How much are we going to tell them to gain total during pregnancy?
Oh, wait. Oh, there it is.
There it is. Okay, I was gonna say you guys are close.
I was
Yes.
like, ooh, we might win this. Nope. I figured
Right.
someone would come up with
So
it.
it does depend on their weight, but it's based on a range. So if their BMI falls in the what the BMI chart says is the healthy weight. Listen, I could rant to you all day about why BMI is problematic nonsense, but for NCLEX, you have to know. So if their BMI falls between 18 and 25, then they should gain exactly, 25 to 30 pounds during
25
the
to
entire
35. 25 to
25 to
35.
35 during the entire course of their pregnancy. Now, if they are underweight, if their BMI is below 18, they would be expected to gain more. If they are overweight, they're expected to gain less, so on and so forth. So that's super important to know for your maternity class too, but also in nutrition. You got to know it.
Totally.
Yep.
Yeah. You got to know it in both places. Okay.
Yep.
So let's have people take a small break here, so everybody can enter our contest for
Ooh,
a
yeah.
Nurse Squad giveaway. So here's the deal. I'm going to tell you what to type in the comments if you want to win a Nurse Squad game. You can only enter one time. If you enter more than once, then Angelina will throw out your entry. You will not get to win Nurse Squad. So only enter one time. Okay. Everybody hear me on that, because I want everybody to be eligible. I don't want you to have to get kicked out, because she'll do it too. Okay.
She will. Yeah.
Totally. Oh, is this the cart?
Sorry. In the meantime, I didn't mean to, but I was just going to show you
I'm
it.
interested in seeing
In the
it.
meantime, yeah, look at this. Look at
This
this.
is
Tell
so, I
me
love how
this is
skinny it
not
is.
magical. I know. This is incredible. I'm obsessed. Look at how all of this fits. Like the Nurse Squad games, she's got stickers right here. We've got all of the flashcards down here. Like, tell me this isn't unbelievably incredible. This is what I use
love
to
it.
store my books, like that I'm going to read, like my upcoming reads, but I never thought to use it for our level up stuff. This is brilliant. Brilliant.
That's awesome. That's awesome. I need one of those. Yeah.
Yeah.
Yeah, and it's on Amazon, I'm
Oh,
assuming.
big time. That's where I got mine. So I'm assuming same, because
You get
this
anything
looks
on Amazon,
identical.
really.
I mean, truly, yeah. But God, that's beautiful.
Okay, you guys, yeah, I love how slim it is. I love how skinny it is. You have like next to your desk and roll it around and have it with you wherever. Yeah, so thank you for sharing. I love it.
So cool.
Okay, so if you want to enter our contest, you're going to put in the comments, one time only, Nurse Squad for the win. Nurse Squad for the win. That's what you're going to put in there, because I can't do anything simple, because we used to do just easy things, but no. Nurse Squad for the win. And Angelina will add you to be eligible to win a Nurse Squad game, which we will announce the winner towards the end of our live tonight. So Nurse Squad for the win. Nice.
I love you guys. You would crack me up.
Oh, I know. If you guys have ideas for, no, then we can't tell Meris, though. So I can't have you share your ideas.
I know.
I need silly ideas for things for people to enter.
Oh no, I just got a message from Angelina. I feel like Angelina is like the banker on Deal or No Deal. She just told me she is not feeling the number of likes on this live, which means y'all already know, if you don't like this video, she won't let us give this away. We gotta you guys have to like this video.
So
It's
everybody like the video. Yep. Everybody hit that thumbs up button. So, because Angelina's like in charge of our social media and everything, and she cares deeply about this.
She keeps us on track. Yeah.
Totally. So hit that like button. Nice. Nurse Squad for the win. You got this. You got this. And I love how Dee Dee put the little trophy. I have
Yes.
I have that
So
on my
cute.
list. I'm going
Yeah.
shopping on Amazon
Just
after
like
this. Maybe for
underlining
that
it.
cart too. The cart and the trophy, you
I love
know?
it. Oh, Jorge was the first to like the video, so thank you very much.
Awesome. Awesome. Okay. I just asked you that question. So now
I ask you guys. If
yeah.
your username starts with A through L, it is your time to answer this question.
Yes.
Team Meris.
Team Cathy, get ready.
Zip it, Team Meris. Fight. All right. Oh, this is a good one. Oh, I love this. Okay. What is the name for an amino acid that cannot be made by the body and must come from food?
Okay. Yep. So, what kind of amino acid cannot be made by the body, must come from food? What type of amino acid is that? Yes,
Jessica,
Jessica.
yes.
Yep. Thank you. It's an
Yep.
essential. So we have, yeah.
It
Yep.
is
We have essential.
that you eat it, right?
Right.
It's not essential, non-essential to eat the others. Your body can make it. I mean, it's good. That's great. But it is essential that you eat this one or else you won't have it in your body.
Right. Totally. Okay. We have, oh shoot, we just had that question. Hold on. I think we must have shuffled our stuff in exactly the same way. Oh man, this is easy. All right, 1 point. 1 point foundations question. This is for Team Meris. So the people who should answer this have a name that starts with an M through a Z. And if your name starts with a, yeah, if your username starts with A through L, then we're not gonna give it away. Okay. Which vitamins are fat soluble?
Oh, come on. We got this. You already know. We already know we got this. We have a great clue for this. Which ones are fat soluble? Super duper duper. Yes, it is easy, Clarissa. A, D, E, and K. Absolutely, Nurse Rose on the go. Yes, ma'am. You are correct. So think of a fat deck of cards. A fat deck. D-E-K, right? Not D-C-K. Deck.
No,
A-D-E-K. Yes, fat soluble.
Nice job, guys. Nice job.
Kathy and I have talked several times about maybe we need to come up with a cool chicken after dark, because I have some really raunchy ways to remember things, and every time this one comes up I just want to tell you, but I can't. So maybe you gotta let us know if you want a little cool chicken after dark series or something, because maybe we'll do that in membership.
Totally. No, I have to rein in some of my cool chicken hints as well.
Yes. Yeah, let me type
hard.
this so that you guys can see. A fat deck of cards. A fat deck, not D-E-C-K, right? Because that could trip you up with the C. Yeah. You don't want that.
Because what are our water soluble vitamins? Which ones are the water soluble vitamins?
All the rest of them.
Yep, it is. But what are they?
Trisha, Meris, play a hazard card.
She's gangster, man. She will play that. Yes. Okay. Fine. Play that card.
Oh yeah. All right. Let's do it, bestie. All right. This is me all day, every day at the ER. Okay. Because if you come to the ER, listen, okay, let me just soapbox real quick. Do not come to the ER having not had any food in the past 3 days and then immediately say to me, I haven't eaten in 3 days and I'm starving. Baby, I can't feed you because you're NPO. So this says, come on.
I love that card.
Just some water or a cracker, anything. I'm starving. Why can't I just eat? For the 3rd time today, you'll have to explain to Mr. Ship what NPO means and why he can't have anything to eat or drink. And there you are, putting tape over his poor mouth saying, no food, you're NPO.
Right. And people who are NPO, patients who are NPO and desperate, they will ask every person that comes in their room. They'll ask the PT, the OT, the provider, the nurse, the CNA, anyone who comes in there to get them some water or some crackers or whatever, right? So you kind of have to, as the nurse, you got to let everybody know they're NPO. Do not give them anything.
Yep. So This is, so Team Cathy is busy explaining to Mr. Ship why he cannot eat any food. And so they now face a hazard on a 3-point question. Trisha, you didn't even know that was coming up, but baby, I was going to play that hazard card. So.
Okay. All right, Team Cathy, if your username starts with A through L, this is the question. We have to get this right or we lose 4 points, okay?
Yes. Okay. I'm going to read the top question just because I think it's easier to answer the bottom in more of it if you're playing verbally. Yeah, so I'm just going to make that one a little bit easier. Is putting tape over a patient's mouth considered under restraint? That's considered battery, my love. We're not doing it.
No. These little hazard cards are just like for funsies. Like they take like real nursing hazards, but then kind of exaggerate them. Like, here's the nurse like balancing all the trays onto her head and feet and stuff. So it's just, they're kind of silly hazards. What else do we have here? Or like, trying to unplug the NG tube, right?
Or me doing a swallow screen in the
I love that. I love that one. I love these hazards.
Me too. Actually, I think the nutrition ones are some of my favorites. They're really funny. Okay. All right.
Team Cathy.
Here we go. If your username starts with A through L, this is your question. Team Meris, zip your lips or else we'll fight. All right. This disorder is caused by severe protein deficiency and is characterized by abdominal distension and peripheral edema. This disorder is caused by severe protein deficiency and is characterized by abdominal distension and peripheral edema.
Okay. So there's another one that's caused by just like calorie.
Oh my God.
Whoa! Oh my God, I didn't even get to say a clue. They like got it right out of the gate. Kwashiorkor.
Yeah. Oh my God.
Wow. Team Cathy's on fire, man. We are on fire.
Well, luckily for Team Meris, you don't get any points from that. So
okay. All right. Well, maybe we'll go ahead and play a hazard on you. And this will probably be the last. Well, I don't know who went first. Anyway, I'm going to play this hazard on you and then we'll figure out if we have.
Yeah, then we'll have one more because you asked us first. So then we'll have to.
All right. This is clogged tube.
Oh my God.
There are a lot of skills a nurse needs to have in order to be successful, but you never imagined plumbing would be one of them. You'll get a crash course in NG2 plumbing while you unclog Mr. Jefferson's tube for the next few minutes. All right.
And let me tell you, unclogging an NG tube is legit time consuming. So, oh my God.
All right. You guys ready?
Ready.
What are 4 signs of dehydration?
Oh, come on. We got this. Come
I
on.
need 4 signs of dehydration.
Just start listing. I know you got it. We're dehydrated. So we have fluid volume deficit, right? So just waiting for them to start rolling in. I believe in you. 4 signs. Oliguria, pallor. Well, yeah.
No.
Dry skin.
Okay.
What about skin turgor?
What about the skin turgor? Oh, here we go.
Fatigue,
BP,
weak pulses,
increased heart rate, tenting, oliguria. Yep, there you go.
Yes.
Yep. Nice job. Okay, so yeah, they listed any 4 of the following: decreased weight, tachycardia, hypotension, tachypnea, decreased urine output, increased thirst, decreased skin turgor, dry mucous membranes, and a weak, thready pulse.
Yes, absolutely. Remember, fluid volume deficit, we have normal pipes, but low volume. So we're going to have a weak, thready pulse, but we're going to have what's called compensatory tachycardia. Remember that your cardiac output is necessary to keep your organs alive, and your cardiac output is stroke volume times heart rate. If our stroke volume is low, because the volume is low, then the heart rate needs to go up. So people get weirded about like tachycardia and thready pulse. It's a weak pulse because there's water trickling
There's not a lot of
fire
fluid.
hose.
Yeah.
But it's going to be fast. It's going to be very fast, but it's going to be faint.
Totally.
You guys are so good.
All right. Courtney thinks it's pretty cool. This is pretty cool. We're having a good time. All right. So
I'm dead. I'm dead.
yeah,
This is
you have to
so
know that for
true.
ATI.
So
Yeah.
true. Yeah, you've got to know that when you have urine output less than 30 mLs an hour, that's like a call the doctor, like big time.
Notify the
red flag.
provider. Notify the provider. Totally. All right. So you have one more question to ask me, and then we'll announce our winner and then add up our points. We're going to announce the winner of the game tonight for reals. Like we didn't do that last time, but we're going to do that tonight. Okay. All right.
Don't forget to get your free month of membership. Don't forget. Use the code free month.
It's only good through tomorrow night at midnight.
Yes, exactly. So until the 24th, you can get it. So, all right. 2-point question. Foundations. Okay. Excessively high levels of which type of cholesterol can lead to sticky plaque buildup and increased risk for atherosclerosis, heart disease, and stroke?
Okay. What's our bad cholesterol? If we have high levels of what cholesterol type? Okay, well, there it is.
Oh my God.
LDL. That's right.
Yes.
So L for lousy, L for lousy, H for happy. So we like our HDL. We need our HDL to be high enough, but we need our LDL to be lower. So L for lousy, H for happy. So good job.
I went with L for lethal and H for healthy.
Because
I wanted to think about you're gonna die if you have too much LDL. Okay. I'm being a little
You're
dramatic.
going to that real dark place, like real quick.
Well, I mean, that's who I am. That's why this is me, right? The crazy black cloud trauma ER nurse.
All right. So Angelina, do we have a winner?
Yes, we have a winner.
Okay.
She sent it to me. I don't know why me, but
that's fine. Probably because I can't like pronounce the name. Maybe that's probably why.
You would be able to pronounce this one though, so I feel bad.
Okay. Right. So Angelina, in the future, if it's like an easy name, then
send it to Cathy.
Send it to Kat. Let me be like, oh, let me announce. And it's really hard, then you can send it to Meris. That's fine.
Yep. All right.
Okay.
Sorry, I'm just flashing these up on the screen. I love this. L for loser and H for hero. Highly desirable and less desirable. I mean, honestly, like I feel like this is lends itself perfectly. One. Yeah, this is great. I love these.
Totally.
Yeah, and absolutely, I love this. Don't forget to smash the like button. We're really bad at this. We're like, I don't care, but
I know we're like in the throes of
in the zone. Oh my God. Okay, the winner of our Nurse Squad giveaway tonight is Edward. Edward, you need to send an email. Edward, email support@leveluprn.com.
Congratulations. So reach out to support@leveluprn.com. Let them know that you were the winner tonight and they will take care of you. All right. We ready to add up points? I'll add up your points. 3, 4, 6, 8, 9. Okay. Let me just double check. 6. All right. Team Meris got 9 points.
Team Cathy got 9 points.
Ah! It's a tie. It's the first time we tied.
The good news, Cathy, is I got 2 trophies.
Oh my gosh. I'm gonna find the biggest trophy
one for
ever.
Team Cathy. Here's your trophy.
My virtual trophy.
Yes.
Yay.
Yay.
So congratulations everybody for doing an amazing job. Nobody, we didn't even have one question where people got it wrong. Like you all answered every question correctly. So that's great.
Should we do, wait, somebody said tiebreaker. What if I ask a 3-point question and the first person to answer it, whoever, if they're A through L or M through Z.
Okay. All right.
Want to do that?
Okay, we'll do this, guys. You ready? So Meris is going to ask a question, and the first person to answer it, if they're on Team Cathy, then it'll be the tiebreaker, and Team Cathy will win. And if it's Team Meris, then Team Meris will end up winning. Okay, so listen carefully.
Team Meris, I need you to just listen, focus. Are we all dialed in?
Girl, she's intense, man. Let's go.
Intense. That trauma nurse energy. All right. Xerophthalmia is caused by a deficiency in which vitamin? Xerophthalmia.
And we won't give any, don't give any, we don't know.
Trisha, she's got me. Trisha, I know you got this. Sorry, I got excited.
I was
Nope,
gonna say, that's
not
not
that
it.
one. That's not that. I just saw the S and I got stoked.
Oh, Austin!
Austin.
We are the champions. We are the champions. Nice job, guys. Team Cathy.
Austin, you and
I. Vitamin A for the eyes.
Austin,
So.
listen to me. Look at me. I'm gonna catch you outside. All right.
So xerophthalmia.
It's
like drying of the cornea, like dry eyes, right?
Sure.
Okay, you're so it's drying the eyes. So vitamin A, like carrots, sweet potatoes, all your kind of like, orange type of vegetables and fruits and stuff like that. Those things are rich in vitamin A, and they help prevent eye issues. So they help prevent vision issues and xerophthalmia. So
yep.
That's definitely a condition you should remember, because I do remember being tested on that.
Oh, big time. Yeah, this stuff, I will say one of the things that I remember the most is what happens with a deficiency of each vitamin. Like you just got to know too little vitamin A, too little vitamin B6, 12, all of these different ones, too little vitamin C. You've got to know like xerophthalmia, scurvy, pernicious anemia. Like you have just like be able to like rapid fire.
Totally.
It's gonna come up. Yeah.
Totally. And those are all on our flashcards. We've got like some great hints for remembering a lot of those, like B2, your two lips will be swollen if you are lacking in B2. So if you like all those fun ways to remember stuff, and you don't have our flashcards, you would love our flashcards because they have all of those cool
big time. Okay. And also don't forget too, we've got, where the heck is it? Oh my God, Maris. I was going to show you the tip of the day calendar, which seems to be MIA. But that has, the tip of the day calendar has tips every day has a new tip, and there's different cool chicken hints on each, not each one, but on every week at least plus. And it's not something you tear off. You just flip it, and then it's like year after year you can reuse it because it doesn't have like the year on it. Yeah, so
totally.
There you go.
Yeah, and all of the tips are like super test worthy things that you definitely have to know in nursing school.
We don't play with stuff that you don't need to know.
Totally.
Yeah.
Totally. We're here to help you get that level 3, get that A, pass that NCLEX in the minimum number of questions. We're here to help you rock it out in nursing school. So
big time, because we know how hard it is.
Hey, thanks guys. Thank you so much for joining us and for playing and just for all the support and love, and we hope you'll join us again for next time. So do we have a date for next time?
We don't, because we're picking it on Friday, I believe. So stay tuned. You guys know it's going to be here. Like we're going to do it here. It's going to be a blast. We have now officially played every Nurse Squad game, like all of them that we have right now. So if you want to go back and watch some of the old ones, they're all recorded. They're all available so that you can watch maternity or peds or whatever. And I guess next time we'll have to do a like
survey,
an ask the audience sort of situation. So keep your eyes out, because we'll put that out on YouTube, on Insta, Facebook, all of that kind of good stuff, and you can vote and say which one you want to do. I can already tell you, Cathy and I are going to pick what we want to play. Like we're going to give you 4 options, and then you'll choose. So nutrition is definitely on there for me. So we'll see.
Totally. So we'll ask on YouTube and IG, and maybe it goes on Facebook too. I don't know.
Our Instagram stuff goes to Facebook, so it'll be there too.
Okay. All right.
Yeah.
And we'll see. We'll add up the votes from both places, and we'll play whatever you guys vote on. So just be looking for that. So if you aren't following us on YouTube, on Instagram, then definitely do that so that you can help pick our next game that we're going to play.
And so that you can see Cathy's guns when we go on vacation together, because I'm telling you, they are like You will be shook. You will be shook. I can guarantee.
I mean, I don't know if I'm like, she's hyping me up in a big way here. They're good. I don't know if they're like.
It's because I've seen them, okay?
I better get on it, man. I'm going to work out more tomorrow. All right. All right. We'll see you guys next time. All right. When does the level up? You know what? We do have dreams of this. We feel like we could do a really good job of it, actually.
Would you want, like, we would be the coolest professors ever. President Cathy and Dean Meris, like, come on.
Totally.
That'd be really
Totally. Cool. Yep. Flash the gun. So, yeah. Oh. So there's. I'm all about the upper body. Well, I work out the whole body, but yeah, I'm all about staying strong. So as I get older, I can preserve that bone mass and my muscle mass and all that good stuff. So
yes, that weight bearing exercise. Go redeem your free month. Don't forget, redeem it. Code free month.
All right, sounds good. Okay, guys, it was so fun. We'll see you next time.
Bye, friends.